Hi everyone, welcome to my presentation. So now we can discuss the drugs used in the treatment of cardiovascular system and blood disorders. So let us see first question. Digoxin is not used when heart rate is. Digoxin is not given or used when heart rate is below 50, below 60, below 70, below 80. And before that, the normal heart rate is 60 to 100 beats per minute. So when the heart rate is below 60, we should not prefer the drug digoxin. Okay, the next question. Dopamine is preferred in the management of shock because it decreases cardiac output, it has prolonged action, or the option C has peripheral vasoconstriction effect, has renal vasodilatory effect. And the answer is B, has prolonged action. It has a renal vasodilatory effect. So this is the correct answer. So dopamine preferred in the management of shock because it has renal vasodilatory effect. And not only that, because of this function, it saves the organs from damage due to shock. Renal organ from damage due to shock. The next one, which of the following drugs should be first administered in the patient admitted with a diagnosis of acute myocardial infarction? Which of the following drugs should be first administered in a patient admitted with a diagnosis of acute myocardial infarction? Acute myocardial infarction, also called heart attack, acute heart attack. In this situation, which drug we should administer first? ACE inhibitor, aspirin, calcium channel blocker, statin. And the answer is aspirin. So why? Because this aspirin is a powerful antiplatelet agent and it has the capacity to reduce the mortality by 20%, and the dose of aspirin is 50 to 300 mg. We can administer to the patient. Then next question, which electrolyte imbalance may predispose the patient to digitalis toxicity? Which electrolyte imbalance may predispose the patient to digitalis toxicity? So digitalis toxicity is also called digoxin poisoning, and it is a side effect of digitalis consumption. Then, so the main effect of this digitalis toxicity is causes congestive heart failure. So it's a situation which electrolyte balance will affect. Which electrolyte imbalance we can see? Hypercalcemia, hypermagnesemia, hypokalemia, hypernatremia. Hyperkalemia, hypermagnesemia, hypokalemia, hypernatremia. And the answer is hypo. Okay, then. So the conditions or symptoms caused by after digitalis toxicities include hypokalemia, hypomagnesemia, hypothyroidism, hypoxemia, myocardial disease, myo. So all you can remember, hypo. Here all hypo is there. There is no hyper. Hypokalemia, hypomagnesemia, hypothyroidism, myocardial ischemia, and altered autonomic tone. Okay. The next question, calcium channel blockers which are used in the treatment of hypertension include. Calcium channel blocker which are used in the treatment of hypertension include prazosin, enalapril, captopril, nifedipine. So the answer is nifedipine. Nifedipine is a calcium channel blocker used for the treatment of hypertension. So this one is a alpha. So prazosin is a alpha blocker, nifedipine is a calcium channel blocker, and this enalapril and captopril, these two are ACE inhibitors. The next question, Which of the following receptor is activated by low doses of dopamine? Which of the following receptor is activated by low doses of dopamine? Dopaminergic, beta 1, beta 2, alpha. And the answer is A, dopaminergic. This dopamine activates the dopaminergic receptor when administered low doses. Low doses of dopamine activates the dopaminergic receptor. High doses or normal dopamine activates the alpha and beta 1 receptor. Remember here. Low activate dopaminergic. Then normal or high activate alpha or beta receptors. The next one, the main drug of choice for heart failure is. The main drug of choice for heart failure is Decadron, digoxin, morphine, Scorlay. And the answer all we know, digoxin. The next one, the procedure which involves giving a synchronized counter shock to convert undesirable rhythm to stable rhythm. Undesirable rhythm is nothing but if the heart rate is deviating from the normal rate, so that we can call undesirable rhythm. That may be tachycardia or bradycardia. So, which procedure we are using to change undesirable rhythm to stable rhythm? Defibrillation, cardiac stimulator, pacemaker, cardioversion. And the answer is cardioversion. So almost these two are similar, but when the heart rate stopped, okay, when the heart rate stopped, so we prefer the procedure defibrillation. Okay, so if the heart rate is deviate, if the heart rate deviates, then we can use the procedure cardioversion. Then identify the calcium channel blocker from the following. Identify the calcium channel blocker from the following: nifedipine, atenolol, Lasix, mannitol. Okay, here you can see the list of calcium channel blocker. Dipyridine, calcium channel blocker. It is classified into two types: dipyridine, dihydropyridine and non-dihydropyridine. Then here you can see amlodipine, nicardipine, nifedipine, nimodipine, felodipine. So these all the medications are dihydropyridine. Then non-dihydropyridine, parampil, diltiazem. Okay. So in previous what we discussed, so there is no, in that classification there is no this one, atenolol, Lasix, mannitol. So here the answer is nifedipine. So nifedipine is a dihydropyridine. Then next question, which among the following medicines is used for the pharmacological closure of patent ductus arteriosus? Which among the following medicines is used for the pharmacological closure of patent ductus arteriosus? So patent ductus arteriosus is a congenital defect, a congenital heart defect where a blood vessel in the heart remains open after the birth. Okay. Patent ductus arteriosus is a congenital. Remember, congenital heart defect where a blood vessels in the heart remains open after birth. Open after birth. Or if the blood vessels in the heart opened after the birth, so that condition we can call patent ductus arteriosus, and we can call this is a congenital heart failure, congenital heart defect. Okay. So in this situation, which among the following medications is used for the pharmacological closure? So actually the heart blood vessel opened here. So what medication we can prefer at this condition? Methoxamine, acospirin, indomethacin, prostaglandin. The answer is indomethacin. Indomethacin is a pharmacological drug used for the closure of patent ductus arteriosus. The next question. A patient can become toxic on a normal dose of digitalis when the dash is present. A patient can become toxic on a normal dose of digitalis when dash is present? The answer is already we have discussed in previous question. The answer is hypokalemia. If the person has hypokalemia before administration of this digitalis, then it causes the side effect digitalis toxicity after administration. So we should not give the drug when the patient has hypokalemia. Then next one, verapamil is a, already we have discussed, okay? Beta adrenergic blocker, H2 receptor antagonist, cardiac glycoside, calcium channel blocker. The answer is calcium channel blocker. Then dobutamine causes increased cardiac output, marked increase in HR, increased total peripheral resistance, marked increase in blood pressure. So this is also general question. The function of dobutamine drug is increased cardiac output. Then a 50-year-old male patient is brought to the emergency room with acute heart attack or myocardial infarction. Which of the following drugs should be administered first? Already we have discussed here. Okay, in the first question, third question we have discussed here. So which drug we have to give? ACE inhibitor, aspirin, calcium channel blocker, statin. The answer is aspirin. Okay, the next question, which of the following instruction is appropriate in regard to nitroglycerin for a patient with angina pectoris? The patient with angina pectoris, if the patient is taking drug nitroglycerin, so as in a, what instructions we need to give? To take it before meals, to take with a glass of water, to store it in amber colored bottle and keep it away from the sunlight, none of the above. So before that, let us see what is angina pectoris. Here you can see angina pectoris, commonly we can call chest pain or chest discomfort, and the cause of this chest pain is when the heart muscle not receiving proper oxygen rich blood, it causes chest pain or discomfort, or medically we can call angina pectoris. Now can you tell the answer? The answer is the nitroglycerin drug we should store in amber colored bottle and keep it away from the sunlight. The next one, which of the following is an early indication of digitalis toxicity? Which of the following is an early sign or indication of digitalis toxicity? Visual aberration, fatigue, seizures, headache. The answer is visual aberration. Then next one, atenolol is an alpha adrenergic blocker, beta blocker, anticholinergic agent, cholinergic agent. The answer is B. It is a beta blocker. So the use of this atenolol is used for the high BP. Okay. The next, which of the following is not indicated in the digitalis poisoning? Which of the following not indicated in the digitalis poisoning? Potassium, hemodialysis, phenytoin, lidocaine. The answer is hemodialysis. Because digitalis has high volume of distribution bound to tissues. Digitalis has, after administration, okay, after toxicity, it has the high volume of distribution in the tissues. So it is difficult to remove from the tissues. It is difficult to remove from the tissues. So that's why hemodialysis procedure is not preferred or indicated in the digitalis poison. Then, which of the following is a protective lipoprotein? Which of the following is a protective lipoprotein? LDL, VLDL, IDL, HDL. The answer is D. Okay, high density. HDL is nothing but high density lipoprotein called protective lipoprotein, or another name for this high density lipoprotein is good cholesterol. Then next question, the action of cardiotonics is decrease the force of contraction of heart, increase the force of contraction of heart, treat Rheumatic heart disease, treat primary hypertension. So this is also general question. The answer is B, increase the force of contraction of heart. Then last question. So which of the following drug would be the least effective in lowering a client serum potential level? Which of the following drug would be least effective in lowering a client serum potential level? Glucose and insulin, polycystin, sulfonate, calcium gluconate, aluminum hydroxide. Please give the answer in comment box. Thank you all. If you like my content, please subscribe my channel. Thank you.